Welcome back to Soft Nursing Pediatric Disease Disorders Part 3. And today we're going to talk about Kawasaki disease in children. So, what is Kawasaki disease? Simply, Kawasaki disease is an acute systemic vasculitis that can affect the coronary arteries, which can also further affect the blood supply to the heart. So, in a nutshell, Kawasaki disease is just an inflammation of the blood vessels. Now, let's talk about the signs and symptoms of Kawasaki disease. Number one sign and symptoms of Kawasaki disease that you're going to see on your exam is going to be increased fever. Yes, fever from 102 and above for 5 days straight. Yes, that is Kawasaki disease. Rashes, red eyes. The child is going to have red eyes, and also swollen lymph nodes, swollen hands and feet that will start peeling off in the later time of the disease process, and also red tongues, commonly called strawberry tongues. The child's tongue is going to look really reddish like a strawberry. When you think about which age group does this Kawasaki disease affect, just keep it in mind that Kawasaki disease affects age 5 years old and less. Yes, that will be Kawasaki disease. Now, later in the disease process, when this disease is not properly treated on time, this disease is gonna progress to affect the heart. It's gonna cause some heart defect, some cardiological defect in this child. This child is gonna start having subabdominal pain, joint pain, and the swollen hands and feet are gonna start peeling off. Basically, when they start peeling, or when the child start having abdominal pain and joint pain, too much weakness, basically, just know that this disease process is upgrading itself to affect the heart. What will be your nursing intervention for this child having Kawasaki disease? Think about it. Some of these questions you answer with your common sense. Number one is going to be that you will lotion that dry skin. Okay? You will lotion their skin. You would be checking their fever. You can give them Tylenol, acetaminophen for fever to help them reduce the fever. Monitor their cardiac output. This is really important for us to know when this disease process starts upgrading itself to affect the heart. We don't want that to happen. Now, in summary, how can we treat Kawasaki disease? Basically, keep it in mind when you see it on your exam that you're going to treat Kawasaki disease with IVIG, meaning intravenous immunoglobulin, and you're going to treat that alongside with aspirin as well. Now, IVIG is going to help to reduce the inflammation of the blood vessels, okay? So clock that. I wish you all the best in your exam. Let me know if you like this so we can do more, okay?